Hi everyone, my name is Chanel and I'm taking the BCIT Breastfeeding Experience course in order to specialize in perinatal nursing. I'd like to welcome you to my very first video assignment where I will be discussing one maternal and one infant breastfeeding challenge. The breastfeeding challenges that I will be exploring are a mother suffering from mastitis feeding her baby with Down syndrome. I will be describing how I can best support this mother-infant dyad using a situated clinical decision-making framework, which looks something like this. The situated clinical decision-making framework is a tool used by nurses to assist them in making decisions in client care by facilitating an understanding of the complexity of everyday clinical decision-making, guiding decision-making in a clinical and theoretical context, and allowing one to critically reflect on clinical decisions and learning needs. As you can see, this framework consists of 5 components: knowledge, cues, judgment, decisions, and an evaluation of outcomes. The first condition I would like to discuss is mastitis. The word itself means inflammation of the breast tissue, but it often refers to an infection of the breast tissue, milk ducts, or both. Mastitis occurs when bacteria enter the breast through the nipples in breastfeeding women. The infant may introduce the organisms into the milk ducts by sucking where they proliferate. This is because breast milk is an excellent medium for bacterial growth. Most cases of mastitis occur during the first 6 weeks of breastfeeding, although mastitis can occur at any time during lactation. One of the most common factors that can predispose a woman to mastitis is inadequate emptying of the breasts. This may be related to engorgement, plugged ducts, a sudden decrease in the number of feedings, abrupt weaning, delayed breastfeeding initiation, or pressure on the breast from wearing an underwire bra, which may cause constriction. Other predisposing factors include stress, fatigue, maternal illness, breast trauma, or poor maternal nutrition. Sore or cracked nipples can also lead to mastitis because it provides a portal of entry for organisms. The next condition I would like to discuss is Down syndrome. Down syndrome is a genetic condition caused by abnormal cell division in early embryo development. Trisomy 21 is the most common type of Down syndrome. Those with this type have an extra chromosome 21 in every cell. Having an extra chromosome changes the way the brain and body develops. Down syndrome is the most common chromosomal disorder and occurs in about 1 in 800 pregnancies. In women who are older than 35, the incidence is as high as 1 in 100 live births. Mastitis usually starts off with a painful area in one breast. It is most common in the upper outer quadrant of the breast because this is the area with the most breast tissue. However, mastitis can be unilateral or bilateral. The affected area may be red, swollen, painful, or warm to touch. The woman may also experience a sudden onset of flu-like symptoms, such as fever, chills, muscle aches, headache, or fatigue. Some signs that mastitis is getting worse include swollen, painful lymph nodes in the armpit on the affected side, a rapid pulse, or worsening flu-like symptoms. Complications of mastitis include a breast abscess, chronic mastitis, and a fungal infection of the breast. Most complications can be prevented by early recognition and treatment. My maternal assessment of mastitis will include looking for signs and symptoms and performing a physical examination of the affected breast. The clinical presentation of Down syndrome is complex and variable. The characteristics may include sleepiness, especially in the first few weeks after birth, a flat facial profile that usually includes a depressed nasal bridge and a small nose, slanted eyelids that have an extra fold of tissue at the inner canthus. The iris of the eye may have small white crescent-shaped spots called brush-field spots. The tongue is apt to protrude from the mouth because the oral cavity is smaller than usual. The back of the head may be flat and the neck may be short. The ears may be set low and may be abnormally shaped or rotated. You may see hyperflexibility of the joints and poor muscle tone, giving the newborn a ragdoll appearance. The fingers are short and thick, and the little finger is often curved inward. There may be a wide space between the first and second toes and between the first and second fingers. The palm of the hand shows a peculiar crease called a simian line, or a single horizontal crease. My newborn assessment of Down syndrome will include assessing for sleepiness, the protruding tongue, and diminished muscle tone, as these signs may affect the latching and positioning of breastfeeding. Putting these two breastfeeding challenges together, the breastfeeding assessment should include whether the mother is able to position the baby, if there are any problems with the baby's latch, and how the mother is feeling when she breastfeeds her baby. Based on all this information, I have come up with 3 key nursing priorities. The first nursing priority is making sure the baby is receiving adequate nutrition and gaining weight appropriately. This is important because the protruding tongue, poor muscle tone, and sleepiness may interfere with breastfeeding and the baby's intake. The second nursing priority is making sure the mother is emptying her breasts often. This is important because milk production is a supply and demand system. A referral to a lactation consultant may be beneficial because someone who specializes in helping women breastfeed can provide useful and helpful tips for the mother to ensure success in breastfeeding. A referral to a public health nurse is also beneficial to assess the baby's feeding and the baby's weight. The last nursing priority is treating the infection and the mother's discomfort. Pharmacological treatment for mastitis includes use of oral antibiotics, which usually cures mastitis and does not harm the baby. If the antibiotics do not work at first, a physician may order a breast milk culture to help identify the type of bacteria causing the infection. Reassure the mother that continuing to breastfeed from the affected breast is recommended, as it usually helps to clear up the infection, prevent stasis of milk, and reduces further pain. It is also safe for the baby. The baby's digestive juices will destroy any bacteria in the woman's milk during feeding. If the affected side is too painful, encourage the woman to try to feed from the healthy breast first. Acetaminophen may be given for pain or fever, and ibuprofen may be given for the pain and inflammation. Warm or cold compresses and a good supportive bra may also help with pain relief and reduce inflammation and edema. A baby with Down syndrome may have low muscle tone, including reduced muscle strength in the tongue and lips. Therefore, good head support is important during breastfeeding. The nurse should encourage the woman to apply a gentle, steady support to the base of the baby's head, which will help the baby to suck well without tiring. The mother should ensure the baby gets a large mouthful of breast tissue, which will help the baby draw the milk out and stimulate the breast to produce more. Some breastfeeding positions the nurse can teach the mother include the cross-cradle hold, the football hold, and the dancer hand position. All of these breastfeeding techniques provide good head support for the baby and gives the mother a good view to assess the baby's latch. As many babies with Down syndrome are very sleepy during the first few weeks after birth, it may be necessary to wake the baby up for feeds every 2 hours, or at least 8 to 12 times a day. It may be challenging to keep the baby awake for the duration of the feeding. Therefore, the following techniques may be used to keep the baby awake during breastfeeding. Dimming the room so the baby doesn't have to close its eyes against the lights. Removing the baby's clothes before breastfeeding to keep him or her cool and aware, and stimulating the baby's senses. This last component of the framework allows us to evaluate our interventions. Here we can ask ourselves, is the baby receiving adequate nutrition and is gaining weight? Is the mother emptying her breasts often? Has the infection resolved or is healing? Once answering these questions, we will be able to determine whether additional interventions are required. Some evaluations that tell us whether the treatment and care we have provided are successful are if the mother continues to breastfeed, even though the infection is present, the mother knows who to contact, whether it's a lactation consultant or public health nurse for breastfeeding support, or a physician for follow-up visits. The mother is certain when the baby is positioned or latched on correctly, and the mother understands the purpose, instructions, and techniques of the different forms of treatment. That wraps up this video, but first let's recap on what I've gone through. I have discussed what mastitis and Down syndrome are, the causes of both conditions, risk factors, signs and symptoms, and characteristics. I've discussed the factors that affect breastfeeding and have included a maternal and neonatal assessment. The 3 key priorities I have talked about include making sure the baby is receiving adequate nutrition, making sure the mother is emptying her breasts, and treating the infection and mother's discomfort. I discussed the care and treatment options to address these priorities and evaluated the outcomes to ensure the priorities were met. Thanks for watching, everyone, and I hope you enjoyed this video.